Good morning, student. Good morning, everybody. In yesterday lecture, we was learn about the diseases of cornea and its homeopathic therapeutics in detail. So, from today's lecture, we will study about the diseases of sclera. So, diseases of the sclera, it is the inflammation of the sclera. Firstly, we see in the episcleritis. Episcleritis is a superficial inflammation of the sclera. And when there is a deep inflammation of the sclera, it is called as a scleritis. So, episcleritis, this is a benign inflammatory process affecting the deep conjunctival connective tissue, that is the episclera, and sometimes including the superficial scleral lamina. So, it is the inflammation of subconjunctival episcleral tissue with superficial layer of sclera. Etiology, it is seen in elderly patients associated with the rheumatism or gout, allergic reaction to endogenous toxins like tuberculosis or streptococcus. So it is seen in the young adult, more in a female, idiopathic, most common. Then in allergic reaction to the endogenous toxins, for example streptococcal or tubercular, and infections like herpes zoster, herpes simplex, syphilis, and other collagen vascular diseases. So, on examination, there are two clinical types of episcleritis, diffuse or simple, and nodular may be recognized. Episclera is seen actually inflamed in the involved area. So, pathologically, there is a dense lymphocytic infiltration in the subconjunctival and episcleral tissue. So the symptoms are there is a mild pain or irritation of the eye and localized redness. In the episcleritis, although whole eye may be involved to some extent, the maximum inflammation is confined to one or two quadrants. And in nodular episcleritis, a pink or purple flat nodule surrounded by injection is seen, usually situated 2 to 3 mm away from the limbus. The nodule is firm, tender, and overlying conjunctiva moves freely. Clinically, episcleritis runs a limited course of 10 days to 3 weeks and resolves spontaneously. However, recurrences are common and tend to occur in bouts, rarely a fleeting type of disease, that is episcleritis periodica, may occur. So, this is a diagram of simple and simple or diffuse episcleritis. So, this is a diagram A, simple or diffuse episcleritis, and this is the diagram B, that is nodular episcleritis. So, signs and symptoms in this, there is a pain and tenderness in the eyes, hard pinkish red nodules, no discharges, lacrimation or photophobia, 2 to 3 mm from limbus, nodules fixed to deep structure and tender to touch, never ulcerate, hyperemia of surrounding conjunctiva, and it can spread to deeper layers, so causes scleritis and uveitis. So, this is a complication of episcleritis that it can spread to a deeper layer. So, it can causes scleritis or uveitis. Recurrent attack, then episcleritis periodica fugax, chronic episcleritis, deeper extension into the sclera and leading to scleritis, then sclerokeratitis, adherence of conjunctiva with the sclera after a repeated attack. In the treatment, there is a hydrocorticosterone 1% drop 2 hourly can be used with the local heat. General treatment is more important than local. There is elimination of septic or tubercular sores. So this is episcleritis. This one also. Next is scleritis. Scleritis, it is the inflammation of the sclera, bilaterally seen, more in a woman than men. Toxic and allergic conditions most common. Endogenous infection, that is acute suppurative lesion, tuberculosis, syphilis, leprosy, viral. Secondary infection from peri-intraocular tissues may affect sclera. Systemic and metabolic diseases like rheumatoid arthritis and pathology. There is a inflammation is much more severe than episcleritis. So in this there is an infiltration of scleral layer with the lymphocytes and necrosis of the sclera, that is a thinning. So this is a classification of the scleritis. It can be classified as follows. Firstly, anterior scleritis 98%. In this there is a non-necrotizing scleritis, diffuse scleritis. So this is a diffuse scleritis and nodular scleritis. In that we see a nodule formation with the scleral inflammation. Second is a necrotizing scleritis, 15% with inflammation. So this is a necrotizing scleritis with inflammation. And second is a B, that is without inflammation. So this is a diagrammatic presentation of necrotizing scleritis without inflammation. That is the scleromalacia perforans. And second is a posterior scleritis which is seen only 2%. So symptoms, there is a marked pain in eyes radiating to the frontal region and there is a lacrimation. Signs, there is a pinkish red area with hyperemia of surrounding conjunctiva and patches of scleritis is elevated and tender when the pressure on you. Prolonged course. Complication in that we can see there is a inflammation may spread to the cornea in the form of tongue shaped opacity. So there is a tongue shaped opacity associated with uveitis, that is iritis and iridocytitis. There is a thinning or sclera causes a bulging of uveal tract, that is the staphyloma, which can cause a secondary glaucoma. And treatment, that is the same as episcleritis, and analgesics can be used. So next is a staphyloma. In that, staphyloma is defined as there is a bulging of a wall of eyeball along with the uveal tissue. So there is a bulging of eyeball. Eyeball is bulged along with the uveal tissue. So this is a diagrammatic representation of the staphyloma. Then there are types in that. Firstly, anterior staphyloma. As a result of slugging corneal ulcer, anterior staphyloma is, so when there is a slugging corneal ulcer which leads to a anterior staphyloma. In that there is an interciliary that occur at a limbus immediately in front of ciliary body. Second, B is a ciliary. Due to the bulging of ciliary body, due to thinning of sclera, that is, when there is a bulging of ciliary body, Due to thinning of the sclera, the ciliary staphyloma is formed. Then, due to the scleritis or injury to the sclera, 8 mm away from the leaves. So, this is a diagram of a ciliary staphyloma. So, in that we can see how there is a bulging of the ciliary body, and due to thinning of a sclera, the ciliary staphyloma is there. C is equatorial and D is a posterior, that is the in high myopia. Due to the high myopia, there is a posterior staphyloma, bulging of a sclera at the posterior pole of the eyeball. So when there is a bulging of sclera anterior to eyeball, it is the anterior staphyloma, and when bulging of a sclera at the posterior of the eyeball, so it is called as the posterior staphyloma. Then this is a diagrammatic representation of this staphyloma. In that we can see a staphyloma in that A is a interciliary, B is a ciliary staphyloma, C is a equatorial staphyloma, and D is a posterior staphyloma. So when there is a bulging of the eyeball, interciliary, so it is called as interciliary staphyloma. This is ciliary part. If bulge, then it is called ciliary staphyloma. When there is a equatorial, the equal part of eyeball is bulge, so it is called as equatorial staphyloma. And when eyeball bulging posteriorly, then it is called as the posterior staphyloma. So this is a diagram of staphyloma. So homeopathic therapeutics for the diseases of sclera. So this is in short the diseases of scleritis. Diseases of sclera, in that we was studied the episcleritis, scleritis and staphyloma. So next is a homeopathic therapeutics. In that there is a deep inflammation of sclera, that is a deep scleritis, and superficial inflammation of the sclera, that is episcleritis, then staphyloma after a suppurative inflammation. So many homeopathic remedy we can use in these cases, like aconite, arsenic album, or a mur, hiparsal, kali, mercor, sepia, spigelia, thuja, we can use in a deep scleritis. And aconite, belladonna, bryonia alba, kali iode, mercor, rust of terebinthina, thuja, we can use in a superficial episcleritis. And Apis mellifica, Euphrasia officinalis, and Physostigma we can use in a staphyloma after a suppurative infection. So let us start with the aconite mechanism. We all know the aconite is a very characteristic remedy in eye complaint. In this, objectively, the lids are red, swollen, hard, especially the upper in the morning. Edges sore, inflamed, there is a chemosis, and conjunctiva intensely hyperemic and edematous, mostly toward the inner canvas, and lacrimation slight if in. Subjectively, the patient feels that subjective symptom is what that patient feels that symptoms. So, subjectively, patient feel the eyes are burned, feel dry, sensitive to air. There is a much aching and heat, intense burning, shooting pain, pressure upon the lid, as if the ball were pushed into orbit and causing a bluish pain in the eye. There is a itching, smarting in the evening. The eyeball, especially the upper half, sensitive with mood. Looking down or turning the eyes, the eyeball feel enlarged as if protruding and making the lid tense. Feel as if it would be forced out of the orbit. There is a stooping pain. Eyes feel smaller. Feel as if sand were in them, and there is a protective layer. So vision. So how the patient's vision of iconite, that it is through have it difficult to distinguish the faces, then spark before the eyes, there is a flickering. Characteristics. The aconite patient is characterized by a great anxiety, fear, restlessness, and thirst, and it is useful in the first stage of inflammation or a trauma of cornea, conjunctiva, sclera, and leaf. And it is a routine remedy with the foreign bodies, wound, operation, and for neuralgia from exposure to the dry cold heat. So second is Apis mellifica. We all know that Apis mellifica is made from a honeybee. The tincture is made from a live honeybee and is but little stronger than 3x saturation of a APM virus, which is made by extracting, triturating the poison sac. Objectively, the leaves are much swollen, pale, red, edema, then upper one hand like a sac. Conjunctiva inflamed edematous with a dark red vein. There is a lacrimation which is a pot, and agglutination of eyes is seen. So subjectively, there is a patient feel that there is a itching in the eyes with stinging, sharp piercing pain in and about the eyes. There is a burning, stinging, which causes lacrimation and soreness and smarting in the eyes. Lids, edges, and canthi. There is a fullness sensation in the eye with a photophobia. Eyes pain are easily fatigued and sensation of a foreign body. Then vision. Vision are obscure, difficult with a whirling and pain on using the eyes. Characteristic that there is a thirstlessness even with the fever and drowsiness, edema, dropsy, skin is a waxy white. So, clinically, the Apis mellifica is used in a corneal ulcer, erysipelas, staphyloma after a suppurative inflammation, albuminuria, retinitis, then useful in a various form of keratitis, purulent edema, as a rule, temporary from applying a cold water, an extremely valuable remedy in inflammatory affection of the eyes and always characterized by serous exudation, edema, and sudden piercing pain. Then next is the arsenic album. So objectives are that leads are edematous, swollen, usually non-inflammatory and painless. So when we see the patient with the lid edematous, swollen edematous lid firmly closed and look as if distended with air, and conjunctiva palpable or ocular, inflamed, burning, there is acrid lacrimation making the lid and cheek red and sore, then we can thought about the arsenic album. Subjectively, the arsenic album patient feel that there is a severe burning or a burning pain in the eyes, in the lid edges. Eyes feel dry as if rubbed by the lid. Feeling of a stand and obliging him to rub the eyes in the evening. Eyes hot with a burning sore pain in the ball and a feeling as though they had no room in the body. There is a pulsative and throbbing pain in the eyes, and with every pulsation a stitch. After midnight, supraorbital pain left with a pricking as with needle, ciliary neuralgia, fine burning pain, photophobia. Characteristics we can in this, there is a great restlessness, anxiety with weakness, prostration, and thirst for every frequent small drink. After midnight, burning pain, emaciation, generally by warm application, anguish, despair, dread of death. Clinically, when we see arsenic is useful when there is a puffy below the eyes, corneal ulcer, scrofulous ophthalmia, chronic trachoma, keratitis, iritis, disseminated choroiditis, and hyperthyroidism. So, next remedy is belladonna. So, belladonna, the patient come with a dilated pupil, sluggish or immobile, dilated pupil. Eyes are red. Lids margin congested, inflamed. Conjunctiva congested, inflamed. Lids droop, twitch or puffy, sty, pimples, pustules. Eyes are dry. There is no tears or mucus and tears increase. Increase ocular tension, fundus congested, disc congested, edges are not distinct, retina is slightly hazy, eyes protruding, and there is a bright, starry, solemn with a red face. See constant motion. Subjectively, the patient feels that there is a photophobia, eyes feel dry. Stiffness, aggravation by motion, there is a burning heat, pain or pressure in or about or back of the eyes, sharp, neuralgic, aching, throbbing pain come on and passes off quickly. Eyes are smart, each feel tired, weak, heavy, tender to pressure. Vision are blur, dim, acuity decreases. There is erythropsia, and everything he looks at the same red. Halo around the candlelight, partly color and red, predominating at the time the lights seem broken into the rays. There is a photopsia, flashes, and bright spark. Clinically, it is useful in keratitis and follicular inflammation of cornea. So, next is a Bryonia alba. We all know Bryonia alba is a great deep acting characteristic homeopathic remedy. In this, there is the puffiness of right upper lid. Then there is a morning agglutination, conjunctiva dark, red and swollen, and lacrimation. So subjectively, when we see a bryonia, there is a photophobia and pressure pain in above left eye, pressure inward over the left orbit into the brain, which changes to a pressure on the eyeball from above downward. Pain deep in the right orbit and pressure on the ball. There is a drawing and heaviness in the upper lid, very sensitive pressing, intermittent pain in the left eyeball, especially violent on moving the eye. With a feeling as if the eye became smaller and retracted. In the orbit, there is a severe burning with lacrimation in the right eye, eyes very sore and moving head. So vision of Brania is dim. Every object appears covered with a rainbow color. An appearance of all the color of the rainbow later run together on near characteristics that there is a motion heat. Bryonia is a sphere of usefulness in the diseases of UVL tract, in rheumatic subject, aggravation from a motion by warmth, and for a serious inflammation with this activation. So clinically, it is the first remedy thought of in rheumatic arthritis. Sharp shooting pain through the eyes into the head, motion and pressure, or a steady aching in the posterior part of the eyes extending through the occiput, night motion. It has a check glaucoma and prove valuable in serious iridochoroiditis and ciliary neuralgia with the episcleritis. So it is a great useful remedy in episcleritis. Next is the Euphrasia officinalis. We all know Euphrasia is a great remedy using in eye complaint. Objectively, there is a conjunctival injection. Lids or their margin are swollen and red. There is a profuse acrid lacrimation with a gland coryza. And subjectively, patient shows the photophobia, eyes are sensitive to candlelight, frequent inclination to blink, feeling as if cornea were covered with a mulch which obscure the vision and obliges him frequently to close and press the lid. So tears are hot and biting, lid burn and itch, red margin feel dry. In eye there is a burning, bleeding, itching and obliges frequent winking. Vision is sometimes dim as though a veil in the evening. There is a blur vision better by weeping the eyes or winking, clinically useful in a corneal ulcer, staphyloma after suppurative inflammation, corneal pustules and keratitis. Characteristics of euphrasia is that it resembles a mercury in acridity, but its discharges are thick and excoriating, while those of mercury are thin and active. So, staphyloma after suppurative inflammation, in that we can use euphrasia also. So, next is the hypersulfuris. Hypersulf shows the upper lids are red, swollen, inflamed with a oppressive pain, morning agglutination with the inflamed eyes and whitish red, profuse lacrimation, spasmodically closed lid in the morning. Subjectively, the patient feels that there is a intense photophobia, eyes are very painful in ache in a bright daylight. If it attempt to move them, eyeballs are very sensitive to touch, pains are sore as if bitten. There is a pressive throbbing, shooting, smarting pain and smarting pain in the external canthus with a hardened mucus. So there is a pressure in the eyes as from sand. Vision. In a vision, we shows that we see that there is an obscuration while reading, dim sight by candlelight, blindness on rising and standing after sitting bent over, field of vision reduced one half, continual movement of bright circle before the eyes, then there is a object looks large. Characteristics of this that there is oversensitiveness of the nervous system, hence extreme sensitiveness to touch to cold air and to cold application. The sensitiveness make the subject irritable with a hasty speech and action. Clinically, it is a useful remedy in keratitis, high inflammation of cornea, corneal opacity, and one of the frequently used in eye remedy, acute phlegmomatous inflammation, pustular and ulcerative keratitis with a great intensity of a symptom. There is a deep slugging corneal ulcer with hypopia, corneal abscess, keratoiriditis, cataract or purulent conjunctivitis. So, next remedy is Kali Ayurveda. In that, we see that the objective of this is there is a diffuse keratitis which develops during the administration of Kali iode and improve rapidity upon discontinuing the drug, edema of the lid with a purulent conjunctivitis and chemosis with lacrimation. Subjectively, eyes are burned, pain over the left side of head, and in eyes there is a dark and stormy days. Visions are dim, foggy. Characteristics is that when this remedy is thoroughly indicated, there will almost always be an edematous or infiltrated state of the affected. Clinically, it is a useful for Episcleritis and violent syphilitic iritis with after the abuse of mercury. Iris is much swollen, aqueous, cloudy, ciliary injection. Then there is a bright angry red. pain at night and may be very severe with the photophobia and lacrimation variant. So next remedy is Mercurius. Mercury is a deep acting constitutional remedy in that we see objectively the patient shows that there is upper lid are thick and red like styes, eyes inflamed with a solemn tarsi and very sensitive to touch or light, lids spasmodically closed, there is acrid lacrimation, morning agglutination, eyes forcibly drawn together, inflamed swelling in the region of lacrimal bone, photophobia, gaslight, intolerance of light and firelight, heat, redness, pressure in the eyes, burning and biting, sensation of cutting substances under the left upper lid, and vision of mercury is a dim, a fog before one or the both eyes, eyes drawn together by trying to look at anything and cannot see it distinctly. The much more she tries, the less able she is to restrain the contraction. She is obliged to lie down and close the eyes and blinded by firelight in the evening. Characteristics is that there is an aggravation by night. Discharges are thin, sand acrid, and imply the glare glare of a fire. Clinically, mercury is useful when there is a syphilis is marked. In dacryocystitis, syphilitic lacrimal fistula, eye trouble from working over a fire, there is ophthalmia neonatal, then superficial inflammation of cornea or conjunctiva, catarrh, follicular or ulcerative, conjunctival redness, variable and usually mild. Sometimes a chemosis, keratitis usually from hereditary syphilis, keratoiditis with or without hypopia, and episcleritis. Mercurius pain are generally severe, more frequently tearing, burning, shooting or sticking pain, and not confined to eye but extend into the forehead and temple. Temples often sore to touch, iritis, retinitis, choroiditis,